This is my LP 4.2 strategies and policies slideshow. I guess it's the one of the assignments for the class. So first we're going to talk about the changes in the healthcare system that have affected and been studied in the coursework for my Master's in Management with emphasis on healthcare. The big thing that we're seeing is change in delivery methods. One of those is teleconference and the internet. Due to having the internet, a lot of video chat is available with doctors. Some health-based insurance programs even have a connect to nurse program where you can connect to a nurse over the internet or even the telephone and get a diagnostics that way. I know since the Affordable Care Act has come around, even with some of my insurance companies that I have gone through, I believe that Avera or Aetna had some deals where you could go to their systems and use their online and even get a prescription from a doctor. So it's really changing the delivery methods, and especially in remote and rural areas, this is very important. As the doctors are getting busier and busier due to the Affordable Care Act, many people have access to health care that didn't once before. The changes is the quality of care. The quality of care is pretty high in the United States. However, we are getting a shortage of nursing staff, which is creating stress in the healthcare system today, especially in the long-term care area. I did my internship in the long-term care area, and it's just a great shortage of nurses in that area. And as the population ages, that's only going to increase. Patient resources. Today, the resources of a patient's very informed. Everything's online, from WebMD to Google. They're searching their symptoms and trying to figure out what's going on. When they come into the doctor's office, they're well informed of the possible outcomes and prognoses. This is very different from before when you went to a doctor and they told you what you had and you got a pill. They're very informed and they know the side effects of the pills. They'll research everything. It's a very different world when the resources come up. And the other resource is, due to the Affordable Care Act, all citizens are supposed to have some sort of insurance. So as before, when a patient would come in, they would really worry about the cost of what was going on, where now it's more prognosis and what's going to happen. Which is a good thing. Is really a good thing, so they don't have to worry so much about the cost of it. I was told to compare certain healthcare systems, so I chose Canada because you always hear about the Canada healthcare system. Canada has a statewide healthcare insurance at no cost to the participant. So this is a very good benefit. They say it's at no cost, but it comes as a form as taxes, to everyone. They share the cost, basically. So plans sometimes don't cover drugs or dental, so sometimes those are supplemented with private insurers. Providers are reimbursed for fee-for-service rates. And I did a little research on this because you always hear about doctors having a shortage, and in the Canadian system, that's the big push in America not to do it because the quality of care in lines and that type of thing. And actually, physicians make about $125,000 a year in Canada. Now, compared to $178,000 is the average in the United States. So it's quite a bit of difference, but in the same turn, it's not if you really look at like the Medicare reimbursements for fee-for-service rates that we are required to have in the United States due to the uninsured or Medicare reimbursement. They also save costs on administratives. So I believe the statistic I read was $78,000 a year difference in administrative costs. So that's a huge difference in costs just in filing insurance and paperwork and that type of thing. So I guess it has its benefits there. The downfall is if you have to see a specialist, there's a limited number of specialists in Canada. So it could take a while to see one. I read the list, sometimes it can be up to 4 weeks just to get into a consultation. They did a survey, and most Canadians are satisfied with their health care, the health care that they have received in Canada. The next system I chose was Australia, basically because it was the easiest one to find information on that was next. They have a mix of public and private providers. So the hospitals are run by the government. Um, they have private and public cost sharing. So some of the cost is covered by the government and some is covered by private insurance. It's not wholly covered. It's a universal public healthcare system. So they all have insurance. It's just a matter of how it's paid for. It's usually taxpayer funded from the government hospitals. From what I read, they cover what they need to. You know, the drugs are covered, um, and most Australians are satisfied with their coverage also. So that America, right? We're the Affordable Health Care Act. We see it on the news every day. Private insurance is required by every citizen, or they will get a tax um, penalty. So most people today have insurance through their employers. If that's not the case, there's an exchange for those who aren't covered. The exchange is highly pricey in South Dakota, where I live. I could not afford to purchase through the exchange if I had to. So it's really, really expensive. So it's not really a viable option in South Dakota. I'm not sure about other states. I'm guessing it's just as high. One of the downfalls that is created here is we had two main providers on there, and they're pulling out. And I've even heard that Aetna and Blue Cross Blue Shield are pulling out in certain areas of the country. This has to do with they just cannot afford to be on the exchange for the reimbursement rates. Um, the pre-existing conditions went away. That's one of the plus things about the Affordable Care Act. Also, you can stay on your family's insurance until you're 24. Those are the two big benefits that I personally see that came from the Health Care Exchange Act. Before, there was a lot of people not being covered or paying really, really high premiums due to having pre-existing conditions. Now, having said that, since we don't have a way to weed those people out, essentially, you know, there's fancy terminology for it, but that's what we're doing. Um, the cost of insurance is higher for everybody in the country. When I first started about 10 years ago at a local company, my health care insurance was like $120, and the most I'd pay out of pocket is like 5 or 10. Now, today, switching forward, most premiums have high deductibles with the 1,500 to 2,000 range, and you're paying a copay and even a co-insurance now, which was never heard of before, co-insurance. So that's a big difference right there. So the costs are high because we have to cover those that we weren't covering before. Um, there's a lot of plus and minuses to this, and it's a heated debate, really. But essentially, all Americans are covered one way or another. What we used to do before is we would use the emergency rooms as backups, and they would write off the cost. So that really wasn't an effective system either. Those can get on Medicaid or Medishare. I mean, there's ways of covering it. It's just finding the right ways is really the debate. Funding issues. They all have costs. All of these has costs some way or another to every citizen. Whether you think of it as it's free healthcare, you're paying for it some way or another in all the countries. They can create a strain on government resources. So there's a lot of time and effort put into these policies and these regulations, besides the other regulations that keep hospitals in line and safe for Medicare funding. So, you know, there's just a lot of resources involved with all the healthcare. I believe that the GDP for healthcare is growing, and I believe the last time I heard it was like around 70 something percent in America, so it's really high. The other issue is costs are rising. We have a lot of people getting older in this country, and the costs are just going to keep going up and up. The future, again, the baby boomer group in the United States is growing to that retirement age, which is creating issues in our long-term care facilities. Long-term care expenses are really high. And if you have to pay for them out of pocket, which most people do because long-term care insurance is sort of a newer thing that's coming to the surface in light that a lot of people didn't think about before. But if you have to sell all your assets and get on Medicare or Medicaid to have them help pay for your long-term care, it can be a stressful thing for not only you but the family members. And there's also a gap in there where you're not covered. So you may get switched from a private room to a shared room. I mean, there's just all sorts of issues with the baby boomers retiring. And it's also creating a nursing shortage. The healthcare facilities, we just have a real shortage in nursing, and it's becoming very competitive. You know, we always talk about SWOT in our classes, right? So one of the biggest threats is an outside group trying to steal your nurses. Um, how can you be effective in managing that? I mean, it can take a lot of time and effort. The quality of service can be an issue. If you have no nurses and you have to hire a new nurse, not that there's nothing wrong with hiring a nurse that just passed the next skill exam, but that experience comes with time, and the quality service can lack just because all you can hire is new nurses, and you're taking everybody you can, and a lot of nurses are overworked, so the quality service can go down. Um, I know a lot of our nurses at the Rapid City Regional where we used to live were going to be diamond certified just because of that. Well, now if all your nurses have to be diamond certified, you're really behind. The out-of-pocket cost can be enormous for long-term care, and that's something people don't think about. That's one of the growing problems. Not only that, but your out-of-pocket cost for going to the hospital and the clinics is rising due to more people using that insurance. Insurance companies are increasing your copay. My choice, I would choose the Canada system just because it's simplified. That's the biggest reason right there. Everybody gets insurance, everybody has access to health care. The one big problem would be needing specialty care, but if you have a good preventative maintenance, for lack of a sense, people are going to doctors, they're doing their routine care, it's going to help with the need for those specialists in the long run. I guess that's just the way it is. Improvement in the United States is mostly with the cost of care, and the quality is, we have a good quality program, but our cost is high because of so many lawsuits and malpractice things that even now companies have to do tests that are unnecessary just to cover themselves, from getting in trouble. This is a real issue in the United States. Prescribing and performing tests that aren't needed just because we don't want to get sued. Um, it's a waste of money and time, frankly. So how do we rate compared to the other countries? As you can see in the graph, we spend a lot of money in the United States for healthcare, and our return on investment is horrible. Some of that has to do with things that I talked about, malpractice, and just running tests because we want to run them. And in the United States, since it is a profit company, if you have a machine that you bought and you need to use it, you're going to run a test on it because you have to pay for that machine. Now, I'm not saying all healthcare facilities do that, but if you buy into chemo, you're going to prescribe more chemo to help pay for that machine. If you buy into a different form of treatment, such as radiation, you're going to use radiation because you have to pay for those machines. The healthcare is not free, so. I guess my other point is we're pretty high for spending, and if you look at Canada and Australia, the two I chose, they're almost even with their spending amount, and their citizens are satisfied. Repeal and replace, right? This is a hot topic this month. We hear it all over the news. We want to repeal Obamacare, as they call it, or the Affordable Care Act, and replace it. This has not been successful. And the reason I believe this is because we cannot just get rid of it. Now people are on insurance, and now they have a way to cover themselves, and we can't leave people out to dry. So we're going to have to find a valuable option to replace it. We're going to have to find something that works well for everyone if we're going to replace it, and that can be very hard to do. It took forever to get the Affordable Care Act into place. healthcare has been worked on for years and years and years. And you know, back when Bill Clinton was in office, he tried to get healthcare reform into place, and it just didn't work. I mean, we're talking 20 years ago, and it goes further back than that by all means. But there's that compassion and ethics thing where we have to take care of everybody now in the United States, and we have to find a way to make it work for not only the government, but for the private sector that we have in place as our sustainable healthcare option. That because we can't go and buy out all the hospitals. I guess that's the big thing. So here's my references page. I just pulled them off of ProQuest basically because I used them. The other thing I guess I want to say is, healthcare is a huge topic. So it's really hard to cover everything that's needed, but I tried to cover the basis here. So I really highly recommend that it can be segmented, as far as payments, long-term care, clinical care, hospital care, World Health Organization. I mean, there's tons and tons of topics. So you just need to dive into each one of them. This is sort of was more about coverage from countries, and there's a lot of countries that receive aid from the World Health Organizations and that type of thing. Really, it all starts with who's paying for the coverage and care. And we have a hard time with that because we want to make sure everybody has coverage somehow, one way or another, due to ethics, right? We all want to be loving and compassionate. The problem in the United States is it's all right to be loving and compassionate, but healthcare is a business in the United States, and businesses are out to make money. So you have to find that way to make money and stay in business. Unfortunately, that is the truth. It's just the plain truth. So I guess I really would choose the Canada option. It's everybody's paying for it, but everybody's covered. So, all right. Well, you all have a good day.